Welcome to the deep dive.
Glad to be here.
Today we're digging into something fascinating. It's this hidden link, really, between the temperature outside and how you're feeling mentally.
Yeah, a study by Mullins and White really brought this to light. They found this, well, surprisingly direct connection. It shows up everywhere, from ER visits to just how people say they feel day to day.
Right. So our mission here is pretty straightforward. Unpack this surprising link for you, because it really does offer a new perspective, maybe even on things you already think about. Let's get into what they actually found.
Okay, so what's really striking is how consistent the relationship is. It's almost linear. Basically, higher temperatures mean worse mental health outcomes, period.
And lower temperatures.
Surprisingly, they seem to improve mental health. It's quite different from physical health.
Yeah, with physical health, you worry about extreme cold and extreme heat, hypothermia, heat
Interesting.
stroke.
Exactly. But for mental health, this study shows a steady downward trend as things get warmer. No benefit at the cold end, just things getting worse with heat.
And wow, when you look at the specific numbers, it really drives it home.
Hmm.
They found that for every single degree Fahrenheit increase in the average monthly temperature, there's a 0.48% jump in mental health-related ER visits.
Almost 0.5%.
Ew.
And it doesn't stop there.
No. A 0.35% increase in suicides across the U.S., and even a 0.06% rise in people just reporting poor mental health days. It all adds up.
It really does. And that leads to a big question. Okay, temperatures have been rising for decades.
Yeah.
Haven't we, adapted?
You'd think so, right? Maybe air conditioning helps, or income levels, or better access to mental health care?
Well, the researchers looked at that,
Hmm.
and they found basically no evidence of adaptation cushioning this effect, despite all those changes over time.
So the link seems persistent. It's not something we're just easily getting used to or engineering our way out of.
Apparently not, which is, yeah, quite concerning.
So if we're not adapting,
Hmm.
what is the mechanism here? What's actually connecting the heat to our mental state? How does that work?
The strongest clue, the most suggestive evidence, points towards something, honestly, we can all relate to: sleep. Or rather, lack of it.
Ah, okay. Those hot, sticky nights where you just can't get comfortable.
Exactly. The study found warmer temperatures mean more nights of bad sleep, fewer actual minutes slept. And interestingly,
Yes.
it was the changes in the minimum temperature, the overnight low, that were a stronger predictor of bad mental health outcomes than the daytime highs.
So it's really about not getting that cool down overnight, that lack of relief.
That seems to be a key factor. It highlights just how fundamental good sleep is for, well, for everything,
Yeah.
including our mental stability.
Okay, so thinking bigger picture then, what does all this mean, especially, with climate change and rising global temperatures?
Well, it paints a pretty stark picture, doesn't it? If
Yeah.
heat waves are going to get more frequent, more intense, last longer.
Then these mental health impacts could potentially get much worse.
That's the projection. The study actually estimates potential increases by the end of the century, something like 3.1% more mental health ER visits annually, and a 3.0% increase in suicides, just linked to that temperature rise.
Wow.
Yeah. It really underscores a critical need for mental health services to anticipate this, to be ready for potentially higher demand during hotter periods.
But there's maybe a proactive angle here too, like this research gives us a tool.
I think so. If we know temperature impacts mental health, we can use temperature forecasts, right, to maybe allocate resources more effectively.
Like getting mental health support or crisis services ready before a heat wave hits.
Exactly. Because the study also hints that these acute outcomes, like suicide, they aren't always inevitable. A delayed suicide attempt can be a prevented one if the right support is there at the right time.
Knowing when people might be most vulnerable gives us a chance to intervene. Okay, so here's a final thought to leave you with. Knowing this connection exists, this pretty profound link between the weather and our inner state, how might that change how you personally prepare for, say, a hot spell? Or how communities should think about planning for a warmer future?